Suffer with sciatica pain? Hi, this is Dr. Michael Mountain, Clinic Director for the Southern California Spine Center located in San Diego. Today we're going to be discussing sciatica. What are the common causes of sciatica? We'll also be talking about the different treatment options that are available for people who suffer with sciatica, and we'll also try to point to which is the very best treatment option available. So what is sciatica? Well, sciatica is a description of symptoms. In this case, we're talking about pain that starts on the low back and can radiate into the buttocks. It may stop there, but commonly it'll continue to travel down the back of the thigh and into the lower leg, largely on the side, the outside of the leg. The pain may continue on down from there into the ankle and into the foot. And in some cases, people will get pins and needles, what we refer to as paresthesias, numbness and tingling, all the way into their toes. So it can be very debilitating. It can be a lancinating pain that will basically bring tears to people's eyes. But it's important to understand that when you receive the diagnosis of sciatica, that's not telling you what the problem is. It's just telling you what your symptoms are. It's giving you a label for your symptoms. It's not telling you why you have them. The sciatic nerve is the largest nerve in the human body. It's made up of 5 different spinal nerves that leave the spine and then come together to form a single band, all 5 nerves coming together to form a large nerve, what we call the sciatic nerve. So really it's sort of like your hand, where the 5 fingers come together to form the palm and then the palm to form the wrist. So if you want to visualize it as your fingers are the individual spinal nerves and your wrist is the sciatic nerve. So keep in mind that what sciatica is a pinching of any of the nerve at any point in that presentation. So it could be at this particular upper nerve here that I'm pointing to on the chart. You can see there's 1, 2, 3, 4, 5. There could be an injury here, an injury here, an injury here, an injury here, or an injury here, of varying different types of conditions that can cause your sciatica. There is also something that we'll discuss in the next slide called piriformis syndrome, where this nerve, this large sciatic nerve, courses underneath or through a muscle called your piriformis muscle, and piriformis syndrome is a spasming of that muscle that can give you also sciatica. It's important for the doctor to make sure or establish which one it is that you have. So, the causes of sciatica. The most common place where the sciatic nerve can be pinched, of course, is as those individual nerves leave the actual spine. The most common causes of those pinching, or in terms of pinching those particular nerves, is an injury to the disc. Keep in mind that our spine is made up of vertebra or bones, and in between each bones are these discs, these shock absorbers. These shock absorbers are supposed to do the job of trying to handle the pressures that are being put upon them, but they can become injured, they can herniate, rupture, or bulge, and commonly, or most often, they move backwards, what we call posteriorly, moving towards where all those sensitive nerves are, the ones that want to leave to form the sciatic nerve. When your disc herniates, it irritates the nerve, it gets inflamed, it gets painful, and it shoots all that terrible symptomatology down your leg. Less common types of conditions that can also cause this would be arthritis or bony encroachment, spinal stenosis, which is much more complicated, we'll talk about that at a different day, and piriformis syndrome, which we discussed earlier. How best to find out what is causing the sciatic nerve pain? Well, besides receiving the label of having sciatica, we always want to know what is causing the discomfort, because that way we're going to know how best to serve the client, how best to serve the patient. And so an x-ray is not the best choice. An x-ray shows us bone, it shows us fractures, it shows us pathology within bone, it shows us arthritis within the facet joints associated with bone, but it does not show us the disc, it does not show us the nerves, it does not show us muscle. Therefore, an MRI is always the diagnostic of choice. It is always the film that we want to take. It shows us the important things that are involved with this type of condition. We want to know everything so we can, again, make the very best choice for you, the patient. You can see here a very well delineated herniation, where up above it you've got a fairly normal looking disc for this person's particular age. You come over here, you see that herniation here. Instead of it coming through like a nice kidney bean, it's actually pointing out and creating problems. You also see this whitening effect inside the paraspinal muscle. So this whole area that I'm pointing out right now should look like a nice filet mignon, a piece of steak. But instead you see all this whiteness, and this whiteness is fibrous fatty infiltration, and that's a very good indicator for weakening and atrophy of the muscle associated with the injury itself. Very important for the doctor to know, to be able to recognize that and to be able to do something about addressing that after the disc is healed, because you want that person to have the strength and stability so this does not happen again. So how do we treat the disc herniation most effectively? There's two ways to treat sciatica. There are the treatments that are available that manage the pain. They put a band-aid on it. Some of the examples of that would be pain medication, of course, anti-inflammatories, your oxycodone, your Vicodin, and the such. An epidural shot, which we know is going to remove the inflammation in the area, but will not change the positioning of the disc. Keep that in mind. If you really want to take care of your problem, you should always treat the cause, not the symptom. So far these two do not do that. Physical therapy or chiropractic care, again, are going to try to do things with the musculature that is involved with the condition, but are not going to be treating the disc itself. Treatments that actually change the location of the disc and stop the irritation to the nerve that is giving you your pain would include low back surgery. Of course, that comes with an inherent risk, and non-surgical spinal decompression with the DRX 9000. So which is the best treatment for you? Well, I certainly don't believe that putting a band-aid on this type of deep-rooted, lancinating type of a pain is the way to go. Because if you do put a band-aid on it, you'll be sitting there always wondering, when is it going to come back? And how long must I suffer with it the secondary, third time, or even worse? Surgery, of course, is associated with risk. It has got lukewarm results at best, and the potential for ongoing problems always exist. There is approximately 60,000 failed back surgery syndromes in the United States every single year. So keep that in mind. It is not the first choice, and potentially should be the very last choice for everybody. But the spinal decompression with the DRX 9000, as a result of its latest study, has shown an 88.9% success rate associated with herniated disc. That's an incredible success rate. Absolutely incredible. There's practically no risk, and it will give you your life back. I would love to give you more information about this. If you go to www.paininfoformyback.com, we'll be happy to send you our free patient guide that gives you more information about what we're discussing in terms of spinal decompression, and really show you what it is involved with our program, and so many other things that go way beyond just the decompression itself. And we'll also show you we'll also send you a Show Me DVD. That Show Me DVD will actually show you the entire process in action, so you can really see what it's all about, and really get a hands-on sort of a look to it. If this does not move fast enough for you, you can always call 619-692-0712, Southern California Spine Center, to talk to somebody directly. But I encourage you to go to www.paininfoformyback.com, and that's where you'll receive your free patient guide as well as your Show Me DVD. Thank you, and I look forward to our next topic of conversation.